It put us in this position where we had to approach this dying man and say to him, is $217 too much to keep you alive to continue this chemo plan? I'm Zach. I'm in Chicago right now in my first year of internal medicine residency. Most of the people we take care of have either Medicare or Medicare Advantage. We can look at someone and see, oh, they have traditional Medicare. I'm not going to run into a lot of problems with, can they follow up with our primary clinic? We often breathe a sigh of relief when we see that it's traditional Medicare. Traditional Medicare, anybody can see any of our specialists. We don't go to medical school to be a master of discharge planning, but that's what's going to make someone stay out of the hospital. I just recently had a patient who came in and needed a major abdominal surgery, but she has Medicare Advantage. And so we had our social workers look into placing her somewhere in acute rehab. They found a facility. She liked it. The facility accepted her. And now it was time for insurance authorization. Her Medicare Advantage plan looks at the place and says, no, she's healthy enough to not go to acute rehab. She doesn't need to go there. You're telling me, having never met this patient, that we're incorrect in that assessment and that she doesn't need this care. It's very difficult to have your judgment questioned by somebody who's not in the hospital, has never met the patient, and whose interest is not in the care of that patient. It's in the distribution of these resources that this insurance company deems appropriate. Had it been traditional Medicare, she'd have been okay. An even worse story with a patient who had a pretty significant cancer diagnosis. Our goal was really just to help keep him on his feet until he could be discharged and try this chemo outpatient. But he needed these pills to keep his potassium in control. So we had our pharmacist run it and see how much would it cost. And they were really expensive. We have a program in my hospital. There's some budget that the social workers have that they can pay for certain medications for people. The policy, though, is that before you can give that, you need to talk to the patient and ask, would you be able to afford something like this? It was that expensive because of his Medicare Advantage plan that he had. I have to go ask this man, would you rather die or pay a couple $100s for this pill that your insurance company thinks is unnecessary? It's just the most dehumanizing conversation that you could be forced to have with this person that you've built this trust with. Medicare Advantage tries to sell themselves on as we can do all these other things, but clearly it's not solving that problem.